Hello, I'd like to thank you for giving me an opportunity to speak with you today and to present a topic that is near and dear to me. The topic that I want to discuss with you is Crohn's disease. I'm not sure if anybody here has ever heard of the disease called Crohn's disease, but I'd like to give you a little bit of information about this disease and how it affects the human body and who it affects. The reason that I chose this topic is it is kind of near and dear to me. I work for a medical supply company. We manufacture and distribute ostomy supplies. And people that have Crohn's disease or any other kind of intestinal disease issues use the products that we manufacture and distribute. And for me, the products that we distribute are more than just boxes. The products that we are shipping out of our facility are going to people that are going through a life-changing event. Their life has been drastically changed by this disease. And I'd like to take this opportunity to share some information with you about Crohn's disease. Crohn's disease most often affects the ileum and the colon. It also affects the liver, kidney, joints, eyes, and skin. Fistulas may develop, narrowing of the lumen, obstructions. It can cause a rupture. More serious than ulcerative colitis. It has deeper lesions. The picture up here on the presentation, this is what a normal colon looks like here. This is what Crohn's disease colon looks like here. It has cobblestone. It has fat wrapping around the intestines, and the tissue is cracking here. And also it has the wall is thickening of the colon. And for ulcerative colitis, it has a different feel and a different type of pain to it. With ulcerative colitis, it has ulcerations on the inside of the intestines. And surviving mucus polyps inside the intestines also. The causes of Crohn's disease are wide and very wide. Some genetics cause it. It's an autoimmune disease. Immune systems mistake bacteria and food as foreign. It causes it to attacks invaders. It causes inflammation, ulcerations, and bowel injury. It also has chronic tissue changes. And the environmental effects, the body's reaction to antigens and antigens themselves. The symptoms of Crohn's disease: abdominal pain, cramps, nausea, vomiting, diarrhea, malabsorption, diarrhea, fever, general malaise, bleeding, anemia, changes in bowel sounds, and also has dissension. Some other problems that can come along with Crohn's disease are arthritis, skin problems, decreased bone density, growth failure in small children, unintentional weight loss, psychological issues. Who is at risk for Crohn's disease? Genetically predisposed. 20% of Crohn's patients have a blood relative with IBD, irritable bowel disease. Risk for people who are at risk, at high risk, are Jewish people from Jewish heritage, African Americans, most commonly diagnosed between the ages of 20 and 40. Second peak between the ages of 50 and 70. Affects men and women equally. Prevalence of Crohn's disease: 500,000 people in the United States are known to have Crohn's disease. 1 in every 544 people. Smokers are 3 times more likely to develop Crohn's disease. So diagnosis of Crohn's disease, they have blood tests to test for anemia, blood loss, iron, or B12 deficiencies. ESR, CRPs, WBCs, colonoscopies also are a way to detect it. Medical nutrition therapy, diet is recommended for people with Crohn's disease. You have to regularly watch out for what you're eating and keep a healthy diet. Also, in closing, I would like to say that this is a very close topic to me. Like I said before, I have a friend that has been diagnosed with this disease, and there is no cure for this disease. He will live with this for the rest of his life. He doesn't have to have an ostomy, but his life will forever be changed with this disease. And I'd like to thank you today for giving me an opportunity to speak with you.